Hello, I am Amado Alejandro Baez. The topic of my NIE focuses on the convergence of kinetic terrorism and cyber attacks, specifically addressing implications on the United States healthcare system. Scope note: this NIE evaluates the risks and implications of concurrent kinetic terrorism incidents and cyber attacks targeting healthcare infrastructure, with a focus on reducing hospital response capacity, drawing on historical examples of kinetic attacks including New York City September 11th and Boston Marathon bombings of 2023, combining it with instances of significant healthcare cyber attacks as reported. The NIE aims to provide a strategic analysis of the threat and its implications for national security. And the NIE is developed mostly with open source materials and informal interviews with 2 IC members with data reporting available as of April 29, 2024. Based on the scope, here are the key intelligence questions. How can a hybrid kinetic cyber attack produce more harm? What specific healthcare infrastructure components are primarily targets for concurrent kinetic and cyber attacks? Are there indications of collaboration and coordination between different threat actor groups with expertise in kinetic and cyber? How are threat actors coordinating and planning concurrent kinetic and cyber attacks to maximize damage? How are threat actors weaponizing cyber capabilities to complement kinetic attacks and increase their effectiveness? And how likely are hybrid, convergent, kinetic and cyber terrorism events targeting the healthcare system? This slide just showcases the research involved in this NIE, where we looked at 2 incidents, the Boston bombing and the September 11th attacks, and its implications directly on the healthcare system. We also did an extensive open source review of cyber attacks affecting healthcare, including hospitals and EMS services. And then we looked at case studies, historical, where there was a convergence between kinetic attacks and cyber incidents to achieve goals. This slide showcases how cyber attacks on hospitals are increasing and will continue to increase. We have officially reported 25 cases in the US in 2022 versus 46 in 2023, bearing in mind that a lot of these are not reported and handled quote unquote off the books. We also see that payout is increasing from year to year, creating financial motivations and the opportunity of convergence of ideological with financially motivated actors. And then the other piece is that this not only has an impact on health economy, on system economy, but it also has a significant impact on patient care, affecting length of stay, diverted patients, delayed care, and increased mortality. Our key judgments: we judge with high confidence that very likely adversarial and terrorist groups are increasingly recognizing the potential of combining kinetic operations with cyber attacks to create compounded effects. We judge with confidence that cyber terrorists likely will exploit vulnerabilities in health IT systems, including electronic health records and connected medical devices, to amplify the impact of kinetic attacks. And we judge with high confidence that while ransomware attacks on healthcare systems are very likely financially motivated, the convergence with kinetic terrorism very likely is driven by ideological objectives, opening opportunities for both financial and ideological hackers. The likelihood of such attacks occurring is assessed as probable within the next 5 years, given the high impact potential and historical precedents. Confidence assessments: we are moderately confident based on current open source intelligence and trend analysis that adversaries will attempt to execute coordinated kinetic and cyber attacks on hospitals in the future. Our 4 major takeaways are: number 1, historical incidents such as September 11th and Boston Marathon bombings underscore the vulnerability of health systems to kinetic assaults. Number 2, kinetic and cyber attacks on healthcare infrastructure represent a likely multifaceted threat that combines physical violence with digital sabotage to disrupt critical services. Number 3, with moderate confidence, we believe that adversaries will target hospitals with cyber attacks during kinetic terrorist incidents, aiming to maximize disruption and exacerbate impact. And number 4, intelligence sharing and cyber collaboration between healthcare organizations and law enforcement intelligence organizations is important, considering how hospitals are soft targets and not necessarily articulated with a big homeland security system. This slide just showcases the references that we use and the thorough analytical process, and it includes 28 references from different sources.